My name is Aleksandar Videnovic. I'm a neurologist, division chief at the Division of Sleep Neurology at Mass General Brigham and professor of neurology at Harvard Medical School. I'm joined by Professor Chuck Czeisler, and he has many titles, and he will probably do the better job in reciting all of these titles.
My name is Chuck Czeisler, and I'm chief of the Division of Sleep and Circadian Disorders at the Brigham and Women's Hospital. I'm the Baldino Professor of Sleep Medicine and Director of the Division of Sleep Medicine at the Harvard Medical School.
We have just completed the first sleep panel at the World Innovation Forum here for 2025. It was a lovely discussion with leading experts in the field of medicine that come across Mass General Brigham. And Professor Czeisler was one of the panelists. And Chuck, I'd like you to please reflect on what do you think about how this panel went, and what are maybe the highlights when it comes to upcoming innovations in the future of both sleep clinical care and research.
Thank you, Alex. I mean, the one of the things that was highlighted at the event was that, for example, illnesses like obstructive sleep apnea are much more common than was previously thought in clinical medicine, and that 1 out of 3 men and 1 out of 6 women suffer from sleep apnea. 80% of them are undiagnosed and untreated. One of the big barriers has been that the current treatment, the most common treatment, which is very effective, is CPAP therapy, or positive airway pressure, that is continuous throughout the night, requires people to wear a mask. Half of people who are prescribed this therapy don't comply with the treatment. They don't want to wear this thing strapped to their head. And many of the people who see that that's the main treatment, even though there are some other treatments now that are available, surgery and a pacemaker that can be implanted, that's a breathing pacemaker and other things. But even though there are some other treatments, they see that treatment, they don't even want to consider getting diagnosed because they know that they're not going to do it. What was very exciting from the panel today is that Andrew Wellman came up with a discovery, and it's a fascinating story, Andrew. He started out as a fellow, a pulmonary fellow, who was recruited then by David White to become a sleep fellow, got his training in sleep medicine. After completing his pulmonary fellowship, recognized that sleep-disordered breathing didn't have any great treatment options. And then he said, in order for me to understand this condition, I'm going to get a PhD in biomechanical engineering. And he did that focusing on the airway. And then he began to realize that sleep apnea has many different conditions. We wouldn't say cancer, you have cancer. What type of cancer? It turns out even obstructive sleep apnea is caused by many different types of phenotypes, what he would call them. And then he began to realize that many of these had druggable targets. And he has now innovated a new treatment for sleep apnea. And we had on the panel the CEO of a company that was founded to commercialize, and it was founded by the innovation group at MGB that helped him put all of this together. And they have raised over $300 million to run 2 major phase 3 clinical trials, which were just announced this summer as both being positive. And so they're going to be submitting a new drug application to the FDA probably this coming spring. And so it's a very, very exciting new development that has the potential, coming right here out of MGB. And by the way, Andrew is now a full professor of medicine. So he's been nurtured throughout his career here in the sleep division with coming up with this fantastic discovery, which could change the way this serious condition, which greatly increases the risk of cardiovascular death could change the way it's treated for tens of millions of Americans. So it's and people throughout the world. So it's very, very exciting.
Such a fascinating story, and thank you for sharing all that trajectory and what all took place, to get to that point. It is always hard work and perseverance. We also touched upon today on the link between sleep and circadian rhythms and neurodegenerative illness, disorders such as Alzheimer's disease and Parkinson's disease. And we briefly spoke about the bidirectional relationship between these disorders, meaning how these conditions, as they develop, negatively affect sleep and alertness, but also how preceding years of poor sleep may contribute to the risk of developing Alzheimer's and Parkinson's disease, and furthermore, how treating these conditions early on can minimize the risk for development of Alzheimer's and Parkinson's and other neurodegenerative diseases, and also slow the progression of the disease. We touched upon some really cool AI approaches on how to detect individuals who are at risk of developing neurodegenerative disease. And finally, we touched upon this fascinating sleep disorder, which is called REM sleep behavior disorder, or RBD, which is a prodrome into developing neurodegenerative disease as Parkinson's disease, for example. We now know that individuals who have this sleep disorder, again called RBD, have over 80% chance of developing Parkinson's disease in years to come. And this discovery now opens a great avenues for addressing the disease modification much earlier on, before the cardinal symptoms of Parkinson's disease emerge. And when I say earlier on, we can start 10, 15 years earlier in the process of neurodegeneration, which is really great example how sleep is tightly linked to brain function, brain health, and we are really at a great moment where we are starting these clinical trials that will have a goal of slowing the progression of neurodegenerative illness through targeting patients with a sleep phenotype, specifically this RBD. There was a really amazing team that Dr. Kiran Maskey talked about sleep in school children and adolescents. What are your thoughts about that, and especially about the implications that they may have for a public health, Chuck?
The issue of school start times and insufficient sleep among adolescents and children is really a tremendous public health issue. And Dr. Maskey pointed out that when children don't get enough sleep, they are at greatly increased risk of risky behaviors. And she was quoting from the work of Dr. Matt Weaver and colleagues, in which he showed that children who are and adolescents who are getting less sleep not only are increased risk for motor vehicle crashes, but also for drug use, and also for increased risk of pregnancy and just bad decision making in general. And so that really is a huge public health issue, because children and adolescents are most vulnerable to the impact of sleep deficiency, which, as she pointed out, particularly affects the prefrontal cortex, which is the judgment area of the brain, and disconnects it from the emotional brain, the amygdala. And so now you have the emotional brain taking over unchecked by what should be the control area, because it's been disconnected. And so and we know that sleep deficiency also interferes with education. And so the issue of school start times is an important one. The American Academy of Pediatrics has recommended that schools shouldn't start before 8:30. There are a couple of states who have, California being one of them, and Florida being another, that have said that schools can't start before 8:30, although Florida just repealed that, sadly. So There is slow progress that's being made there, but it's a really important issue that needs to be addressed. I mean, here in Massachusetts, we convinced the legislature to restrict junior operators so that they couldn't operate between 12. Their licenses are not valid between 12:30 and 5:30 or 6 o'clock in the morning. And we saw a 40%. We followed for 8 years. We showed a 40% decrease in fatal and incapacitating injuries among the junior operators just by increasing the penalties for their driving during the nighttime hours.
We have also talked about something that's very dear to us, and that is the concept of circadian medicine, which has such a long tradition here at Mass General Brigham. Chuck, you talked about significance of proper timing for light exposure, and discussed the role of light as the most important time giver for our internal clock, suprachiasmatic nucleus, and overall significance of circadian timekeeping for human health and disease. Perhaps you can share some major points for our audience about this fascinating topic, which frequently sort of gets neglected when we talk about sleep medicine, right? The focus is on sleep, and certainly we are talking more and more about circadian medicine, but there is a room for much more dialogue in that regard as we stand at the moment.
Well, thank you, Alex. Yeah, it's been 40 years since we first discovered that light was the most powerful environmental synchronizer of our internal clock. And that's what keeps us in sync with the 24-hour day. And when we first discovered this, we thought it mainly was regulating the timing of the release of hormones, the timing of our daily cycle of body temperature, the timing of our daily rhythm of alertness and performance, and our variability to sleep at night, which are all very important things and relate to sleep medicine. But we really didn't appreciate at that time the impact it had on other organ systems in the body. And since then, it's realized that in every organ in the body, about 10% of the genes are clock controlled. And it's a different 10% in each organ. And it often is the most important set of genes for that organ, whether it be the heart, the kidney, the pancreas, the lungs, whatever. And so when you add it all up, almost all the genes are clock controlled in one or another organ. And that synchronization is very important for the proper functioning of those different organs and for the health of the person. So it's really important, it turns out, that we get light exposure during the day and darkness at night in order to keep our circadian rhythms in sync, going back to that 40-year-old discovery. Now, just this year, by one of the postdocs in our group, there's been a major finding looking at 88,000 people in the UK Biobank. And they followed them over an 8-year interval. And they found that the cohort that had the greatest amount of light exposure at night had a 25% to 30% increased risk of death in that 8-year interval, driven primarily by cardiovascular death and metabolic related death. And similarly, the cohort that had the least exposure to light during the daytime, which is the other, you need light in the day and you need an absence of light at night. Those who weren't getting enough light during the daytime, they also had a 25% increased risk of mortality over that 8-year interval. So it's not just affecting some obscure internal circadian clock, it's affecting the health of the whole person. And so now I think to the future, we have to harness this information, both through wearables and through other technologies. AI was mentioned today, to provide information to the individuals to enhance their circadian health. This is, as you described it, Alex, low-hanging fruit. This is not complicated. We can help people. We have a website, understandingsleep.org, that helps provide the ABCs about sleep for the general public and separates it from all the misinformation that's out there. I mean, I teach a course for Harvard undergraduates that has anywhere from 400 to 800 people in the semesters that we teach it. And they come in with the craziest things that they've gotten off of the internet, like, fractionating their sleep, setting alarms every hour during the night so that they wake up, they only sleep an hour at a time, and then they wake up, then 2 hours later they sleep again. And they've been doing it all summer before they come to college, to Harvard College, because they read on the internet that this is the best way to get them ready for school. Absolutely crazy. So we had to publish a paper saying this polyphasic sleep, bad. But they're not going to read that paper. They instead look at the TikToks and so on, saying that this is what they should do. So we're trying to combat the misinformation, but we also have to bring it to the patients by providing them wearables, giving them AI, helping them harness this low-hanging fruit, as you called it, Alex, to enhance their health.
Jack, let me ask you this question. What do you think is the most overhyped tech in sleep?
Massive doses of melatonin for people who don't even need it, and which may be doing harm.
One innovation you wish existed today?
A rapid test to assess what time of day it is in the body, and another test to determine whether you're getting enough sleep deficiency.
These are great. I am thinking, and I would like to have a better ways to image sleep. And if we could can have a quick CAT scan to understand really the alertness, the quality of that alertness, and the quality of that sleep. And maybe it doesn't need to be even scan, right? Maybe it doesn't need to be imaging. Maybe it just needs to be a tool that one can employ, and really that tool can tell us, oh, this is an excellent quality of sleep, or this person's alertness is really at its prime. Because we always talk about the sleep quality. Well, what is it? And how do we measure it? If we have a really tool to, the more I think about it, the more I understand what is my question. A tool really to tell me what the great sleep quality is. I would like to have that. Another interesting question is really biggest barrier to progress. What do you think those are?
Lack of knowledge about the importance of sleep.
Well, I think it's a terrific opportunity, Chuck, that we had to do this brief exchange after our successful panel we had earlier today. I'd like to thank you both for participating in the panel and joining me here for this brief podcast that we just had.
You're welcome. It's been a pleasure.
And we really are very appreciative to all the audience that joined us today, and again to the organizers who invited us to be part of this terrific day at the World Innovation Forum. Thank you.